She had health insurance, but one ER visit cost her $7,000. She didn't stay overnight. No surgery. Just 4 hours in the emergency room. Her insurer told her she was covered. But the bill said something very different. Now meet the Johnson family. 2 full-time jobs, full insurance, and still, they went bankrupt. All because their son needed an ambulance. A ride that lasted 12 minutes. This isn't rare. This is American healthcare. And if you think having insurance protects you, just wait, because these stories happen every day to people who did everything right. So why is this happening? Why do premiums rise every single year while coverage shrinks? Where does all the money go? And who's actually pulling the strings? Why does the U.S. pay more than any country on earth, but still leave millions afraid to see a doctor? If Americans are paying record high costs, why does their insurance feel worse than ever? In the last decade, premiums jumped 56%, deductibles doubled, and 40% of Americans avoid medical care because they're terrified of the bill, not the illness, not the injury, the bill. How did healthcare, something meant to keep us alive, become something millions can no longer afford? And here's the part nobody wants to admit. This isn't a glitch. This isn't bad luck. It's the system working exactly as designed. And what you've seen so far is just the surface. Because underneath this system are forces, incentives, and profits that make American insurance worse every single year. And the deeper you look, the more disturbing it gets. Behind this system are traps, invisible, intentional traps that most Americans never see. Traps that decide how much you pay, what care you get, and whether your claim is approved or denied. So let's pull back the curtain, because once you understand these traps, American healthcare will never look the same again. Companies used to offer good insurance, reliable plans, low deductibles, real coverage. Not anymore. Today, employers are quietly cutting benefits, year after year, little by little, until the plan you thought you had barely protects you at all. High deductible plans are becoming the default. Plans that look affordable on paper, but force workers to pay thousands before coverage starts. Employees pay more, they get less. And employers? They slowly step away from providing insurance at all. This isn't an accident. It's a transition, a shift away from responsibility and toward pushing the costs onto Americans who can't fight back. Hospital consolidation, the new price empires. Across America, hospitals are merging. A few giant chains now control entire regions. When one system owns most hospitals in your area, there's no competition, no alternatives, no reason to lower prices. They can charge whatever they want, and they do. Insurance companies can't negotiate. Patients can't choose. Premiums rise because the hospital says so, and everyone else just pays. A medical monopoly doesn't look like a monopoly, but you feel it every time you open a bill. PBMs, the invisible middlemen controlling drug prices. Behind every prescription you fill stands a middleman you've never heard of. PBMs, pharmacy benefit managers. They decide which drugs are covered, how much you pay, and how much pharmacies receive. They manipulate prices using something called spread pricing. They underpay pharmacies, overcharge insurers, and the leftover cost? It falls on you. Drug makers get squeezed. Pharmacies get squeezed. Patients get crushed. PBMs profit in the shadows, while Americans wonder why their medication costs 4 times more than last year. Narrow networks, paying more, getting less. You pay high premiums. You expect choices. But your insurance network? Shrinking every year. Fewer doctors, fewer specialists, fewer hospitals willing to accept your plan. And when the doctor you need is out of network, that's bankruptcy territory. Insurers shrink networks on purpose. Smaller networks mean lower payouts. Lower payouts mean more profit. And the patient is left with a plan that covers everything, except what they actually need. In most industries, competition keeps prices in check. Not in healthcare. Everyone in the system has a financial incentive to raise prices. Hospitals raise charges. Insurers raise premiums. PBMs raise drug costs. Nobody is rewarded for lowering anything. And price opacity makes it worse. Americans never know the real cost. Not before treatment, not after, not even when the bill arrives. The system hides numbers behind layers of codes, billed, allowed, paid, until no one knows what anything truly costs, except the people setting the prices. Insurance companies claim they want lower healthcare costs, but their business model tells a different story. They make money from premiums, and premiums are based on total spending. Higher prices equals higher premiums. Higher premiums equals higher profit. It's built into the system. Then comes the medical loss ratio. It limits the percentage insurers can keep as profit, but only as a percent. So if costs rise, their profit rises with it. They don't lose when prices go up. You do. Every year, insurers shift more costs onto consumers. Higher deductibles, higher co-insurance, higher out-of-pocket maximums. Benefits shrink, coverage narrows, protections fade quietly. It's called deductible shifting, a polite way of saying, you pay more, we pay less. Healthcare in America isn't confusing by accident. It's confusing because confusion is profitable. Complexity creates cover. Cover creates profits. Profits create power. And the more complex the billing, the more layers of middlemen, the more codes, loopholes, charges, rewrites, and denials. The harder it becomes for ordinary Americans to push back. Transparency would cut through all of it. And if everything were transparent, the profits would collapse. This system survives because you're not meant to understand it. Americans have no negotiating power. In other countries, citizens negotiate collectively. In America, you negotiate alone. And alone, you have no leverage. No power over hospital prices. No power over insurance terms. No power over drug costs. Your employer chooses your insurance. Your network is pre-selected. Your rates are predetermined. You enter the system with one choice: accept it or go without care. Americans aren't failing to negotiate. They were never given the ability to negotiate in the first place. America has gone too far off the map. Healthcare spending in the U.S. towers over the world, but life expectancy? Lower. Coverage? Thinner. Out-of-pocket costs? Higher than ever. Americans pay more than anyone and somehow receive less. Every international chart tells the same story. America is the outlier, the extreme, the warning sign. No other wealthy nation tolerates a system this expensive, with results this poor. But America has drifted so far that many don't even realize there's another way. The line that hits hardest. And that is why health insurance gets worse every single year. Not because of chance, not because of market fluctuations, not because of bad luck, but because the system is built structurally, intentionally, unavoidably, to make it worse, by design. What Americans are doing to survive the system. Even in this broken system, Americans are finding ways to adapt, to navigate, to survive. Some are turning to HSAs, health savings accounts, the only tool that lets them save pre-tax money, to fight post-tax medical bills. Others are shopping for plans, comparing networks, premiums, deductibles, trying to outsmart a system designed to be confusing. And many are turning to negotiation services, professionals who battle hospitals and insurers on their behalf. Because in America, even getting a fair price requires hiring someone to negotiate it for you. This isn't how healthcare should work, but it's how millions stay afloat. The new wave of change emerging. But underneath the frustration, something new is forming. A quiet rebellion, a different kind of healthcare, direct primary care, flat monthly fees, no insurance middlemen, no surprise bills, transparent pricing hospitals, posting real prices up front, cutting out the mystery, cutting out the games, and bold new companies, trying to break the old model, rebuilding care from the ground up, one simple price at a time. These are small movements today, but every major change in history started as something small, the closing line, the thought that stays with them. America's healthcare system will not change on its own. It changes only when people understand it, when they see how it works and who it truly works for. And now, a system only changes when the people inside it understand how it works. And today, you do.